To know more about Pentax Medical's commitment to infection prevention, read more about our hygiene commitment on our website.
Got a great program here lined up for the next 3 hours with speakers from different fields of expertise that will be giving their point of view on patient safety, hygiene, and sustainability, all, of course, within the world of endoscopy. Now, to be a bit more precise, the speakers are going to focus on the 4 topics, one of them being the power of choice in bronchoscopy, the importance of endoscope drying, the role and value of sustainability in endoscopy, and the necessity and benefit of training for reprocessing staff. As last time, this event is live broadcasted and will be recorded to make sure that all of those can see the show as they cannot attend. Now, we're going to start with 4 short presentations from the experts who are going to reflect on the topics of today. One of them is going to be live with us here in the studio, and 3 will be joining online. After approximately 1 hour, we're going to have a podium discussion that includes taking questions from you in the audience. After the podium discussion, we're going to have a 15-minute break, and then you can decide which breakout session you then want to view. The first breakout session is going to be about improving clinical practice in airway management with single-use bronchoscopy. And the second breakout session is focusing on maximizing infection prevention in endoscopy, the hygiene commitment of Pentax Medical. My name is Ingmar, and I'll be hosting the first part of the event and moderate the panel discussion. So without further ado, let me introduce to you the 4 speakers in the order that they will present today. The first speaker is Prof.Rocco Trisolini. He's the director of the Interventional Pulmonology Unit at the Fondazione Policlinico Universitario a Gemelli in Rome, Italy. And the title of his presentation is Power of Choice in Bronchoscopy. The second speaker is Dr. Lionel Pinault, who is the Scientific, Technical and Innovation Director at Eurofins Biotech Germande, a company that provides testing and laboratory services around the globe. The title of his presentation is The Importance of Endoscope Drying to Minimize the Risk of Infection. The third speaker is from the UK and is Professor Shaji Sebastian. He's consultant gastroenterologist at the IBD unit in Hull University Teaching Hospital in the UK. And his presentation will be on sustainable endoscopy. The last speaker is Meredith Smart, who is the founder, owner, and CEO of 2030 Labs, a specialized testing laboratory for endoscopes in the UK, and she will be speaking on the necessity and value of training for endoscopy reprocessing staff. So, for all the people in the audience, you can now start commenting and asking questions in the chat box, and I'm looking forward to a really great event. Professor Trisolini, welcome and thank you for joining us online. Let's see if we can have a connection with him. Ah, there you are. How's life in Rome? Okay, that's great to hear. I think you're going to speak about the power of choice in bronchoscopy. After your presentation, I'm going to have a few questions for you, and I suggest the floor is yours, and yeah, go right ahead. I can't hear anything, huh? Can you tell that to them? Because otherwise I can't speak with them. Ik hoor niks van hem.
Oh, sorry. So the problem is that I don't go ahead with the slides. So I will need someone who goes ahead from me from the studio. Thank you very much. Thank you for your kind introduction, and good afternoon, everybody. In the next few minutes, I'm going to talk about basically the problem of hygiene during bronchoscopy. And the presentation will be split basically in two parts. In the first one, I'm going to talk about the infection control in the endoscopy suite. And in the second one, I'm going to talk about single-use bronchoscopes. Please go ahead. The question is, are really bronchoscopes a source of infection? And I would say yes. Certainly, the bronchoscopes are a source of infection. Please go ahead. In 2015, the FDA came up with the safety communications after receiving more than 100 medical device reports regarding infection or contaminated bronchoscopes transmitting infections. And most of these reports came out in the last year of their analysis, which was 2014. Please go ahead. In 2021, there was a new safety communication issued by the FDA. And as you can see, in the 6 years between 2015 to 2020, the number of reports increased by far. There were almost 900 reports, and 7 deaths possibly associated with the infected or contaminated bronchoscopes were first reported. So the problem is a huge one. Please go ahead. In the 2021 safety communication, the FDA also issued some recommendations which are very, very important, and I would like to go through them with you. These recommendations were both for healthcare facilities and for healthcare providers. For the healthcare facilities, the suggestions were as follows. Whenever possible, sterilization should be preferred over high-level disinfection, which unfortunately is quite unfeasible with flexible bronchoscopes. But the FDA also suggests that damaged scope, even with the small imperfection, should not be used. Suggests that the scope be stored in a manner that reduces the risk of contamination or retention of moisture after reprocessing. And then suggests that the manufacturer instruction for maintenance and repair should be strictly followed. And ideally, the facilities should develop schedules for routine inspection and periodic maintenance of the bronchoscopes. And then it issued recommendations for the healthcare providers, which are really, really important. Ideally, the providers should discuss carefully with the patients the benefits and risks of procedures involving reprocessed bronchoscopes, should discuss with them potential signs of infection after a procedure, and should clearly tell them when they should seek medical attention because of these signs. And for the first time, it suggests considering the use of single-use bronchoscopes, either when there's an increased risk of transmission of infection or when an immediate reprocessing after a procedure is not feasible. Please go ahead. Despite the attention the FDA is putting through this problem, in the real world, the attention of the interventional pulmonologist is not that huge. In fact, there's a lot of literature suggesting that we are basically burying our heads in the sand. Please go ahead. And this is related to two key problems. Go ahead, please. The first one is a cultural problem. In fact, literature clearly indicates that many bronchoscopy are completely unaware of the reprocessing guidelines. That non-adherence to the reprocessing guidelines is absolutely common, and that as a consequence, cell infections and infections caused by contaminated bronchoscopes is an abundantly unrecognized event. Please go ahead. The second problem is an organizational one, because as you can see in the slide, the reprocessing is a very complex multi-step process, and mistakes can be done at every step. And the steps, as you can see, are many. To complicate the matter, you have to consider that even when the guidelines are strictly followed for reprocessing, infections can still occur. And these are thought to be related mostly to the use of damaged bronchoscopes. Please go ahead. And as a testimony, I want to show you this single study, which is, I think, one of the most interesting out there in the literature, which was published in 2018. And it involved the direct observation of reprocessing methods for flexible bronchoscopes, including the assessment of physiochem, including the assessment C. 24 bronchoscopes in 3 different centers were examined during the study. And as you can see, the results are really astonishing. In fact, residual contamination was found in 100% of the scope after initial manual cleaning. Microbial growth, including dangerous organisms, was found in approximately 60% of the scopes after full reprocessing. And visible irregularities were found basically in every scope. Please go ahead. And click again. These are a few images from the paper. As you can see, every bronchoscope looked for in the study had visible irregularities. These are external irregularities. Please go ahead. Click again. And these are irregularities of the operative channel. As you can see, as compared to the image in the panel A, which is a normal and a new scope, irregularities in the channel occur after a limited number of uses. Please go ahead. And as you can see, this is not a problem of bronchoscopes. This is a problem of every flexible endoscope. In fact, flexible ureteroscopes and GI scopes develop defects after a limited number of uses. Please go ahead. Among the different steps that the reprocessing process requires, there are a few which are even more neglected than others, and these are drying and storage. And yet, drying is extremely important because it is key to remove residual moisture and avoid biofilm formation, which in turn can facilitate microorganisms' growth. It can be carried out with 3 different methods. In large volume centers, usually the drying cycle is carried out by automatic endoscope reprocessors. But as you can see in points 2 and 3, in smaller centers, manual drying can also be done. After drying, ideally, the scope should be stored, and most guidelines suggest that the endoscopes be hung vertically without valves attached in a roomy cabinet with adequate ventilation to prevent moisture accumulation. Please go ahead. Once more. Well, in our center, we use a different way to dry and store our bronchoscopes. And this is the plasma typhoon and plasma bag. Please click once. This is a certified ultra-fast and complete drying method for endoscopes. Go ahead. Which involves also storage of the endoscopes in a bag, which keeps I would say, the high-level disinfection of the scope for up to 31 days. Please click again. And this improves, obviously, patient safety by eliminating the risk of cross-contamination or recontamination on storage or transport. Please go ahead. The process is a very quick process, which involves 3 steps, which can be performed in less than 5 minutes. In the first one, a laminar flow eliminates most of the residual fluid in the channels. Then, a turbulent flow with heated medical air eliminates the remaining droplets on the channel walls. And at this point, the scope, please click again, is put into the plasma bag, which is connected again for a few seconds with the plasma typhoon, which inflates the bag with ozone, which has antimicrobial properties. Please go ahead. One interesting thing that I will show you in the following pictures is that the plasma typhoon occupies a minimal space, as you can see. Please click once. This is the plasma typhoon. As you can see, it occupies a very limited space. And if you click again a couple of times, you will see the comparison between the size of the automatic endoscopic processors and the plasma typhoon, which occupies a minimal amount of the space of an automated reprocessor. Please go ahead. The plasma typhoon comes with storage drawers that occupy much less space than a storage and drying cabinet. As you can see in the next image, the space occupied by the storage drawers is significantly smaller than that of our storage drying cabinet. And as you will see next slide, the bag, which is lying here on the endoscopy bed, can be transported everywhere in the hospital, but without any risk of recontamination of the scope, which has been obviously already reprocessed. Please go ahead. So to conclude this initial part, what we can say is that there's certainly an underreporting of the rate of infections transmitted by bronchoscopes. The reprocessing guidelines are far too complex, and unfortunately, they are poorly known. Considering this, it is key, as suggested by the FDA, that surveillance of both scopes regarding damages and patients after the procedure is warranted, because you have to consider that infections can be transmitted even when the reprocessing is carried out according to guidelines. And we know that manufacturers are considering alternative designs to facilitate an effective reprocessing, but problems remain. In fact, is sterilization still an answer when scope damage occurs after a few uses nonetheless? And should we actually pass through the use of single-use bronchoscopes? And well, these answers bring us to the second part of my presentation, which will regard semi-disposable and single-use bronchoscopes. As I told you, the manufacturers have been trying their best to improve the designs of these scopes, also to prevent and reduce the risk of infection. For instance, as far as Pentax is concerned, passing from the key series video bronchoscopes to the J10 series, a lot of improvements have been introduced, and some of them regard, obviously, the prevention of the risk of infection. And this involves the use of single-use suction control valves and single-use cleaning brushes. Please go ahead. Once more. But most of the attention in the last couple of years has been devoted to the introduction in the market and the use of single-use flexible bronchoscopes. Now, actually, before the pandemic, single-use scopes were mostly used by intensivists and anesthesiologists for intubation. And I have to say that in the anesthesia setting, microacoustics analysis suggested that single-use scopes can actually reduce the costs as compared with reusable scopes due to a number of factors, some of which have been listed in the present slide. Please go ahead. What has happened is that actually the COVID-19 pandemic has boosted the use of single-use scopes for a variety of clear reasons. First, obviously, they carry no risk of contaminations for healthcare workers and physicians and nurses, obviously. They are much more easily available within ICU and restricted areas, and they can be brought in and out of restricted areas very easily because they are just a scope and a small monitor. So you don't need to bring in and out a big cart. Please go ahead. And as you can see, in the last few years, a lot of them has been introduced in the market. Several manufacturers have come out with single-use bronchoscopes. Please go ahead. And this is the one from Pentax, which is a Puma one, which is certainly a huge progress in this kind of bronchoscopes because it has a really high-definition image quality, as an ergonomics, which is basically absolutely similar to that of the J10 reusable video bronchoscopes, to which we are usually accustomed. And there's a very large suction operative channel of 3 millimeters, which allows a strong suction power for a fast airway management with this large channel. So we are really going towards the introduction in the market of very important single-use bronchoscopes. Let's go ahead. However, the question that we have to make to ask ourselves is, single-use bronchoscopes are really ready for prime time in pulmonology, not in the anesthesia setting, in pulmonology. And I think that to answer this question, we need to make three different considerations. The first one is that actually most endoscopy centers have already heavily invested in reusable bronchoscopes. The first part, an added cost.
I think
the
we're
second problem is that although we have seen the manufacturers are introducing a lot of improvements in these scopes, they still need to improve to replace completely reusable scopes. And then you have to consider a third thing, which is very important, is that there are some specific type of bronchoscopes, such as the one that we used for the peripheral nodule access and for EBUS in the US, that are not available in their single-use version. So basically, some procedures still need to be done anyway with reusable bronchoscopes. So please go ahead. To conclude, what we can say with for the use of single-use scope in pulmonology is that they are certainly useful, but their use has been boosted far beyond what we thought thanks to the pandemic. Certainly, we still need improvements, but they are fortunately ongoing, and that in the next approximately in the next few years, they will only integrate reusable scopes, at least until single-use scopes will be available for specific tasks such as endosonography and such as guided bronchoscopy, which involves using thin and ultra-thin scopes with large enough operative channel to allow to bring into the airways mini probes, ultrasound mini probes, and obviously needles and forceps. This was my last slide, and I thank you very much for your attention.
Thank you very much, Professor Trisolini. We've got a little bit of time for just one question, and we are already getting questions from the audience. So, Professor Trisolini, we have a question of Daniel Winteler, who's actually the creator of Plasma Typhoon, and he has one question for you, and maybe you can elaborate on that. Flushing the channels with alcohol, is that used in your hospital? Because in France, it is not recommended because alcohol is fixing the proteins. Can you maybe elaborate on that?
I absolutely agree with him. We do not use alcohol, but you have to consider that in a few guidelines, it is still recommended. And in some part of the world, they're still using alcohol because the guidelines have not been updated. So we are not using it. I do not recommend using alcohol, but you have to consider that a few guidelines still need to be updated. In some centers, in some places in the world, they are still using this method.
Great. Thank you very much, Professor Trisolini, and thank you for your presentation.